Welcome to the Pharmacist Voice podcast, where we talk about pharmacy topics and careers so that you feel connected to the pharmacy profession and inspired to contribute to it. I'm your host, Kim Newlove, and this is episode 282. The Pharmacist Authors Series returns to the podcast today. I'm so excited. I love this series. Dr. Steve Leuck is on the show today talking about his book, A Pharmacist's Story, an authentic tale of true love, family, addiction, and the practice of pharmacy. You can find the show notes for this episode on thepharmacistvoice.com. I've got a link to Steve and his book. Just go ahead and go to thepharmacistvoice.com, click on the podcast tab, and then find episode 282. In case you're new to this podcast, welcome. My name, again, is Kim Newlove. I am a pharmacist by training, but I am not in clinical practice anymore. I am a voice actor and a podcast host. I went to the University of Toledo College of Pharmacy, and I got my BS Pharm in 2001. I have experience in hospital, retail, compounding, and behavioral health. Now, today, I'm just going to give you a little background information, and then we'll get into our interview. I ran a Pharmacist Authors Series last summer, 2023, and judging by the increase in downloads that I experienced all throughout the summer through all 15 episodes of the series, my audience loved it. Thank you for listening. So because it was so successful, I have brought this series back this summer to inspire you to write a book too. There are 3 episodes in the 2024 Pharmacist Authors Series. I know I went from 15 episodes down to 3, but I went traveling in Europe last month in May, and I only had time for 3. So I've got 1 episode in June, 1 in July, and 1 in August. The first episode is today. This is the June episode. This episode goes out on Friday, June 14th, 2024. Again, Dr. Steve Leuck will talk about his book, A Pharmacist's Story, an authentic tale of true love, family, addiction, and the practice of pharmacy. Then in July, next month, we've got Dr. Helen Sairany. She'll be on the podcast to talk about her new book. This is her second book. It is titled The We You Don't See, Understanding the Long Shadows of Trauma. And then in August, Dr. Janan Sarwer and Dr. Thierry Chim from Publishing in Doses will be on the podcast. We'll be talking about the ebook and audiobook combination that they're helping me publish this summer. That's right, your girl's becoming an author. My book is called Pharmacist Podcaster. It is a planning guide for pharmacists who want to become podcasters. Both the ebook and the audiobook together are a lead magnet for the podcast planning service that I offer through my business, The Pharmacist Voice. I am working on setting up a newsletter for the first time ever for that business, and the automations that will offer the ebook and the audiobook this summer. It is not out yet. Stay tuned to hear more about that later this summer. That's why I'm putting that episode in August. All right, that ends the list of authors on the Pharmacist Authors Series this summer, summer 2024. Now I'll introduce my guest, Dr. Steve Leuck. Steve is a 1987 graduate of the University of the Pacific School of Pharmacy and a California licensed pharmacist. He began his practice in a local community hospital pharmacy where he stayed for 8 years. For the next 18 months, Steve completed a 28-day drug and alcohol treatment program, worked through licensing stipulations with the Board of Pharmacy, and attended a year-long course of study and became a certified addiction counselor. Steve successfully transitioned back to pharmacy, where he worked for the next 25 years in a clinic pharmacy for a local community hospital. During this time, Steve developed and implemented a bedside education and meds-to-beds program in order to educate patients as well as ensure they acquired their new medications upon discharge from the hospital. Throughout this time, Steve founded and developed Audible RX, an internet-based patient medication education platform designed specifically for those challenged with literacy or visual impairment. Then in 2023, Audible RX was donated to a medical information-based nonprofit organization. After nearly 33 years of practice with the same institution, Steve retired and took a half-time position for another hospital, which allows him time to travel with his wife, ride his bike through the Santa Cruz Mountains, and write. During our conversation, Steve explains what his book is about, why he wrote it, where you can buy it, and more. Stay tuned until the end of the episode. You'll hear me read my Amazon.com review of the book and my closing comments. If you are a pharmacist or a pharmacy student, you really need to hear this episode. Now, without further ado, here is my conversation with Dr. Steve Leuck. Hi, Steve. Welcome to the Pharmacist Voice podcast.
Thank you, Kim. I appreciate it. It's an honor, an absolute honor to be on your program.
My pleasure. A fellow audio producer, I know you founded Audible RX a number of years ago, and that's how we first got connected. But then I saw that you wrote a book, and I have a Pharmacist Authors Series, and you are welcome to talk about your book here on the series.
Oh, that's beautiful. Thank you for having me about that. I would love to share the message that I have thought about and worked with for years.
All right, well, let's get started. What is the title of your book?
My book is called A Pharmacist Story, an authentic tale of true love, family, addiction, and the practice of pharmacy.
All right, that's a very telling title.
I cover the whole process. I initially, for the last 5 or 6 years, I've been thinking about my story. And just so you know where I am, I've been practicing pharmacy for 37 years. 28 of those have been clean and sober, and the other 9 were in a progressive and exponential substance abuse disorder. So here I am practicing for 28 years, having the absolute best pharmacy practice anyone could ever possibly imagine, really enjoying my life. And that wasn't the case before. And so I wanted to write this book. I wanted to tell my story. What was interesting is I was having a difficult time trying to define whether do I tell just the addiction portion of my story? Is it just about the pharmacy practice? After thinking about it and talking with my family, some friends, some colleagues, and writing for a little while, I decided the best way to get my story out in order for it to be complete is to do the whole package. I needed to start back from where I was born, tell the story of going through high school, where the addictions had come from, and then my story through college into professional practice, the story of the pharmacist recovery program, recovery, and what it looks like to get back into the pharmacy world and practice again. My pharmacy addiction recovery story is a little unique. Matter of fact, I think it's very unique in the aspect that when I received help, not only did I go through a 28-day treatment program, but I was also involved in the pharmacist recovery program, which I met with other pharmacists and doctors and dentists on a weekly basis. I had private therapy for 5 years, but I also went through a 1-year program to become a certified drug and alcohol counselor. I wasn't positive that I was going to be able to practice in pharmacy again, not knowing exactly how my interaction with the State Board of Pharmacy was going to play out. However, the tools that I got working through the pharmacist recovery program, along with what I learned, this deep dive into where my addiction came from by going through this course to become this addiction counselor, helped me have a deep understanding of who I was, where I came from, what my addiction was about, and it allowed me the tools to feel comfortable walking back into a hospital, sitting down for an interview, telling them my story, being hired and working for another 25 years at this community hospital. That particular story is why I wrote the book. I wanted to get that story out there for people.
It's a heck of a story. I think more people need to come out and tell their stories because the more we shine a light on the fact that people in medicine do fall from grace, there is an actual addiction that can happen, does happen, and people recover from it. When we talk about it, there is less stigma about it. So thank you for sharing your story. And thank you very much for putting a positive spin on it because not everybody has your story. Some people have their license permanently revoked. People need hope, and you are telling a tale of hope in your story.
I believe I am. And if it's reasonable, I'd like to just share a little bit about where my addiction came from. That really falls into why I wrote this book. I feel that other pharmacists have gone through this and not been able to come out the other side. And um, truly, my story shows that my addiction wasn't necessarily a moral misgiving. It was a slow progress of an addiction that built up. Initially, high school. I just have to share this real quick because in high school, I recall and remember that I had a beer and all of a sudden I was outgoing, mischievous, and flirtatious. It was absolutely amazing. It was unlike who I normally was. And I learned, it was very curious to me because I learned that as long as I continued to do what I was supposed to do, I showed up. I talked to my teachers. I got good grades. I went to my after school job. I participated in school sports and government, that I could get away with anything that I wanted to, right? So I packed up that curiosity and I took it with me to college and it grew. Now, what's interesting, back in the early 80s in college, it was the culture where upperclassmen had access to pills through their internships. At least in my circle, that's the way it was. That was just commonplace, and we didn't question it. And so my curiosity grew, and I continued to do really well in school. But at the same time, I continued to be more curious about how I would feel when I took different medications because it was available to me. Now, I know that that's not necessarily the case today. Things are much more strict in the pharmacy world, and interns don't necessarily take as many medications from pharmacies as they used to back in the early 80s. That doesn't mean it doesn't happen. It just means that if they do, they're going to get caught much more quickly. As we all know, that doesn't mean that drugs are not available. There's still drugs and alcohol available aplenty on campus. So I took that curiosity with me to my first job. I'm a hospital pharmacist. Remember, if you had your practice way back when, we used to go to work sick pre-COVID, right? We would load up, we'd have our dextromethorphan, our guaifenesin, our Sudafed, our ibuprofen. We just went to work. That's what we had to do. So there was this one evening, I'm sitting in the pharmacy, hospital pharmacy. My technician is out doing rounds. I'm in the pharmacy by myself. I look up at the shelf and I'm thinking, hey, all day long, we treat patients with the same symptoms that I have with these opioid cough medications. I'm a pharmacist. I know what I'm doing. Like, we're trained in school. We are these doctors of pharmacy and we understand how drugs work. Why can't I just treat myself? So I took a bottle off the shelf, opened it up, took a glug, put it back. 15 minutes later, I'm feeling perfect. It's like, oh, I have cracked the code. I now know how to treat myself. I took that tool with me over the next 8 years. I would have a sore throat, a cough, I didn't sleep well the night before. It didn't matter. I found that there wasn't anything that a dose of opioid cough medication wouldn't make me feel better with. The trouble was, I was now at the point where I was having a difficult time stopping. I couldn't not treat myself. We know the opioid addiction cycle. It was difficult. And when I would stop for 36 hours, I would start to go through withdrawals and I would have stress and anxiety that I would be under the blankets with pulled over me shaking. And so all I knew how to do was treat myself. And the trouble is, it became exponential. And for the last 18 months, I had been doing of my use, I was doing, cocaine, opioid cough medication, and benzodiazepines 3, 5, sometimes 7 times a day. I was in fear, dreadful fear that I was going to get caught and taken to jail. I didn't know how to stop. Interestingly, it didn't concern me that I was practicing impaired. That part just flew over my head. I didn't think that was an issue because I'm a professional. I'm a pharmacist. I was doing what I was supposed to do by showing up and practicing. Misguided judgment. Big deal. Too smart for our own good. So at this point, there's 3 things that can happen. Number one, we can be intervened upon by friends and family. We can be intervened upon legally or a spiritual intervention. Second, we can end up in an institution, hospital, jail, mental health unit. Or third, we can die. And it can be from suicide, which is a viable option at this point in time because you are so incomprehensible, demoralized that you don't have any idea how you're going to get out of it. You can have an accident or you can have an overdose. All right. For me, fortunately, it was a spiritual intervention that happened one morning. I talk about that a lot in my book about where that came from. It's not necessarily what we want to chat about here today, but it gave me the power to sit and tell my wife, I'm a drug addict, I need help. And that morning also, I was able to call up the manager of where I was working and let them know. And I told them, if you need to, call the sheriff, whatever, I cannot do this anymore. And to their credit, they knew about the Pharmacist Recovery Program. I did not. They called the program. The next day, I was in a treatment facility and enrolled in the Pharmacist Recovery Program. That is why I wrote the book, is to be able to share that with people that we can get through it, that there is a way, there is a path.
Thank you for sharing that. Like I said, I think you're going to give people hope. And also, this is a cautionary tale. You're just like anybody else. I mean, you graduated from high school when you were 18, and then you went to pre pharmacy school and pharmacy school. This could happen to anybody. And for someone to read your story, I think they can get a lot out of it that they'll relate to. Like, this sounds like me. I went through high school and maybe I had some struggles or maybe I had some curiosities. This could happen to me. So
Yeah,
that kind of brings me to who should read this.
that's super important. What I would like is I feel like this is an excellent read for pharmacy students so that they can see it up ahead. Secondly, practicing pharmacists should know about this because on at least the California State Board website, there's a specific, this is interesting, there's a specific notation that says 40% of pharmacists and 60% of students have taken controlled substances without a prescription. And then, so that's interesting, but that's really no big surprise. That doesn't mean that everyone who takes a controlled substance is going to be an addict. However, 10 to 15% of all pharmacists at some point in time in their career are going to have some sort of substance abuse disorder difficulty. That's a lot of people. That's 15 out of every 100 pharmacists. And what I want people to understand when they read this book is that the Pharmacist Recovery Program is available. It's an anonymous and confidential way that someone can call into and they can get a counselor on the line that doesn't tell the State Board of Pharmacy, doesn't tell their employer that they're calling in. They just help a person identify the severity of their particular disease process, whether it's mental health disorder, alcohol, drugs, other addiction, whatever it may be. They help them identify that severity so that they can direct them into a treatment program. And then they'll help monitor it if necessary. As opposed to the other side of the Pharmacist Recovery Program, which is not anonymous and confidential. It's legal, required, and very non confidential. That's the point at which the state gets involved. They find you, and they either have the Pharmacist Recovery Program as an alternative to disciplinary action or in addition to disciplinary action in order to maintain your license. And for me, what's interesting is mine started confidential and anonymous. But after a week and a half or 2 weeks, I had called the State Board of Pharmacy on my own to let them know that I had taken these drugs from this particular pharmacy. And I didn't want the pharmacy to take a full hit for everything that I had done, the director. And so mine quickly became legal and required. And I got my name in the State Board of Pharmacy newsletter for all my friends to see. And that was one more step in the process because what the recovery program allows and what it teaches is it helps teach you how to wake up every morning and live without taking drugs or drinking on a daily basis. It teaches you what tools to use. It teaches me specifically how to take responsibility for my actions that I have done. And it also helps introduce me to the tools necessary to re-enter the workforce.
That was a lot of great information. So it sounds like if a pharmacist listening to this who has already developed some sort of a problem could reach out to the same organization and get some help, right?
That's correct. I'm very familiar with the California program, and it's not run by the State Board of Pharmacy. It's a recovery agency that is contracted with the State Board of Pharmacy to run the program. And I've looked into many other states, and they're all very similar. They all have their own particular direction that they go. However, they all have every state has some sort of program available that could be found on the State Board of Pharmacy website for that particular state.
As we're talking, I'm thinking about in Ohio, where I live, we have the Pharmacist Rehabilitation Organization, also known as PRO. I don't know all the details, but I have a feeling that the counterpart for what you're talking about in California, in Ohio, would be that Pharmacist Rehabilitation Organization. And at the state level, we have an annual meeting, the Ohio
Okay.
Pharmacists Association annual meeting, and they have presented there, which I thought was amazing because even though I don't have a problem, if somebody I know does have a problem or they haven't realized they have a problem, I can be a resource for them. Knowing about
Correct.
these things is important.
What I really want to get out to people, for the people who read the book, especially the students and pharmacists and any other healthcare professional, anesthesiologists. I only bring up anesthesiologists because in my group that I went to at the program, there were about 10 of us. Half of them were anesthesiologists. And working in a hospital, I've come across many nurses who have had difficult times. So the idea being that any healthcare provider has a story. And if they have had any sort of difficulty with any sort of substance abuse, it's great to be able to read the story of someone else who has had a difficult time with substance abuse, asked for help, went through the process, and survived, came out the other side having a second chance on leading the best practice they could ever possibly imagine, which is really cool. And I think that one of the big takeaways is that it truly does provide you with a new lease on who you are, where you came from, what you're capable of, and opens up many opportunities to be, for instance, one of the positions that I took just by default going into this hospital pharmacy. It's a medium, mid-sized hospital, and maybe 14 pharmacists on staff that rotate through, and a slew of technicians, and then the doctors and nurses. Over time, I became the addiction resource for everyone there because I maintained a process of being open to communication. I let everyone know at different times when I had one-on-ones with them, because you always get one-on-ones with people when you're working in an environment, that if they had any questions about the program, my story, so that they could feel comfortable working with me, please ask away. I'm open to anything. And I think that's one of the important things that we learn when we go through a program like this, is that we need to be the same on the inside as we are on the outside. We need to walk the walk, not necessarily preach, but be available for someone. And we learn to be able to be congruous. Our actions are congruous with our words.
I see what you're saying. Yes, you're not hiding it. You're basically
Correct.
stepping out as a role model. Let's use that term because we all need role models. We need a story to look at, relate to, and then if we are having that same problem, follow in their footsteps. That's what I feel like you're saying. You are that person who's walking the walk so somebody else can look at you as a role model and follow in your footsteps.
Exactly. Thank you for that. I couldn't have said it better. I really appreciate you pointing that out that way. Thank you.
You're welcome, and thanks for being a resource. You being on this podcast, you may end up being a role model for somebody listening to this that really needs to hear your message. So thank you for being here.
Yeah, even if we get one person, that's that's all it takes.
Absolutely. This book has been published and it will be out there for years and years and years, of course. So this book will continue to be something of a resource for years to come.
Right. I agree. So I have three particular points that I'd like to make sure that people get out of the book. Number one is that real important for this to be able to shed light on the incredible chaos that one individual can cause. Even though I may have thought my life was totally under control. I'm showing up at work, doing 50 hours a week. Everything is going how it's supposed to go. I'm making plenty of money, paying the mortgage. My wife is staying at home with the kids. Right. It's a beautiful picture from the outside in. However, on the inside, my relationship with my wife is falling apart. The kids at 2 and 4 years old are feeling these crazy emotions stirring around that house all the time. And my brothers and sisters and dad are having a difficult time communicating with me. My physical being is deteriorating, and my spiritual connection is all but disintegrated. And so it's important to realize that even though we think we have it all under control, we don't. And that there is a village of people out there supporting us that we don't recognize. Secondly, I wanted to make sure that everyone realizes in this particular thing, and what I really tried to highlight in the book is the strength and courage of my wife, Susie, who was able to hold the family together when I wasn't able to. Real important. And thirdly, I want everyone to realize that, or one of my goals in this, my third goal in this book, is to, as you have said, Kim, to role model what it looks like to be in fear that you're going to lose everything, absolutely everything, that people are going to find out the deepest secrets that you've been hiding. Ask for help. Everyone finds out, and come to find out the world doesn't fall apart, that it is treatable, that we get help, and that we can come out the other side much stronger from it, and that we can then take that message forward and pass it on to others who might need it, and to be able to role model that process.
Thank you for sharing all those key points. I was going to ask, what's the book about as I opened up the conversation, but you totally nailed it right now. Thank you for sharing that. Like your goals for the book. That's why you wrote it. That's what it's about.
Yeah, right. Thank you.
Yeah, you're welcome. We talked about who should read it, students and practicing pharmacists. I think this would be a good time for me to ask when they should read it.
My thought is that they should read it today, anyone and everyone. And the reason why is they may not be having difficulty themselves. However, it's important to see that addiction can be sneaky. It can be sitting quietly inside of you, and you have no idea it's going on. It can teach you to be manipulative. It can teach you that telling lies now and again is okay, and that can slowly grow. Addiction can help me think that I'm smart enough to manage things on my own, that I know what's going on with me and I can treat myself. And because I'm a doctor, because I have the training, okay, it may not be legal, but why bother them? I'm a pharmacist. I know what I'm doing. I can just go ahead and take care of it. That we need to take time to think about those thoughts. And it may also help someone have a conversation with someone else who they think may be having a difficult time. It's very difficult to bring up a conversation with someone else who is abusing drugs, or who is not following the rules and breaking the law in their practice. However, it needs to be broached, and everyone does that on their own way. There's no specific rules about how we engage someone else. We all have our own techniques. I know how I would do it, very gently and very, very openly, in a way that exposes myself. And I have found that the best way to get someone else to talk about themselves is for me to first share something that exposes me to them, so they can see that I am vulnerable. And it lets their guard down a little bit, and they're able to share back a little bit. And by doing that, it opens up a delicate conversation that we can slowly move forward with.
Having tough conversations is tough for a reason. I think finding that entry point into the conversation, into the topic it's delicate and you have to use tact. I have always been kind of an in your face, blunt kind of a person. Fortunately or unfortunately, we're all blessed with the personality we're blessed with.
That's right.
But hearing your advice is important for me because that may change my approach if I were ever to approach one of my friends who has a substance use disorder and has not identified it in themselves. So thank you for that advice. That's good.
What you're referring to there specifically is the idea of, correct me if I'm wrong, but the idea of revealing something in yourself first with them so that you are breaking down the barrier and allowing them to feel vulnerable themselves. Is that correct?
I think that is the approach that you had told me about just now.
Yeah.
And
Okay.
I'm saying I learned that from you
Yeah.
just now
Okay.
when it
Right
comes to
on.
addiction disorders. I don't think I previously would have used that approach. My approach would probably have been, do you see what I see type of a thing? And I wouldn't be
Right.
sarcastic about it, but I would try to say that I see this. But when you're talking about saying something vulnerable first, I would have to find the thing that I think that particular person would relate to and then start tearing down walls essentially so we can get on the same page and they
Yeah.
can see what I see. The approach is negotiable, in my opinion. There's
True.
more than one way to approach a conversation, and using your approach might be more effective in this case than mine.
Well, we all know that the idea of coming right out and saying, "Hey, I saw you do this," is going to get someone most of the time to say, "No, you didn't."
That is possible. That is possible. So thanks for the coaching. I appreciate you saying that people should read this book today because I agree with that. I have thumbed through the book, so to speak. I did not read the whole entire thing yet, but one of the things that I want to credit you for is having a chronological approach. You talked about high school to, pharmacy school, getting married, having kids, and the addiction disorder and getting help, like all the things, right? So at any point in this book, somebody might identify with that, whether they're a student or a practicing pharmacist, new or experienced. I think the when is certainly now because whatever stage the audience is in, when they read it, they might identify with something. I
Correct.
like that you didn't just focus on the very hardest moment of your life. It's like the whole thing. You gave us the whole picture.
Well, that's interesting, Kim. I agree. The I had wondered sometimes if people actually want to read about the fun times that I had as a family after becoming sober and when the kids are still little. I call them the wonder years, right? And I put that in there specifically just to show that life is possible. That these are the miracles that come true. The ones that we wish for when we're in college and we're thinking about what our life is going to be like. And mine quickly took a wrong turn, and I realized that I wasn't going to have that particular life. And then after this intervention and my treatment and the process, all of a sudden, this amazing life began manifesting for me. Right? Not only the incredible enjoyment with my children and the trips that we got to take and the fun times with my wife, but the pharmacy practice as well, the ability to focus on, you're right, you mentioned Audible RX, which was a passion project for me for 10 years, working on trying to help bridge that gap so that patients can take responsibility for their own therapy by understanding their medication treatment, right? We have all these things in place for people to understand their medications, to understand to maintain their adherence. But one little niche of that is people who understand why they're taking the medication, the consequences of not taking the medication, that particular population, that can significantly increase adherence and outcome as well. And so I followed that path for quite a few years and ended up donating it to a nonprofit organization so it can get the exposure and the help, help the population that needs to use it. As well, having the opportunity in the pharmacy to put together bedside education. We called it bedside MTM. It was a process where we cold called patients that fit into particular categories, new diabetics, new cardiac patients. And I had the opportunity to put this program together where we would, on a daily basis, cold call 5 or 7 patients in the hospital before they went home, just to break down any barriers to adherence they had, talk about their medications, devise each particular session and visit upon that particular individual. Not every individual gets the same discussion, because everyone has a different level of understanding, and you have to gear every conversation to that patient's level of understanding, whether it's them or someone else in the room with them. But that was, it was a fantastic opportunity, and it wasn't, if it hadn't have been for the tools that I learned through the pharmacist recovery program, showing me that I still had all of the skill set, that it was just this substance abuse disorder getting in the way of my process, that I wouldn't have had that opportunity to begin to develop that. And these days, right, I retired from my full-time position 2 years ago, and I work 2 days a week and 1 weekend a month at a different, smaller community hospital in town. And they brought me on specifically to develop their discharge med reconciliation education program, which is fantastic. So we now visit every patient before they walk out the door and discuss their medications with them. It's, a dream type of position. That, of course, that doesn't take away from the technical aspect of verifying and clarifying orders, which we still do, and that's like the root of where we are, and it's incredibly important. But having a vision, having a plan, and being able to work through that process and continue on is where it's at.
It's like one of those pain to purpose things. You found some purpose in your pain, this process that you had to go through in your rehabilitation, and you used the skills and tools and knowledge that you got from that, and you turned it into a passion project, and you used it to help other people. I think that's
Yeah,
really
thank you for
cool.
that.
You're
I
welcome.
appreciate that.
How long have you been in recovery?
I have been in recovery since March 11th, 1996. So that comes out to 28 years and 11 days, just about, I believe.
As we
Um,
record this in March,
yeah,
yes, it is.
right, exactly.
Yep. Congrats.
It's been an amazing run, and it feels just like yesterday. And part of the idea behind this process is to realize that, just like any other disease state, I'm still a drug addict and an alcoholic. And I let myself know that every day in my prayers. And I need to remember that and stay current with that, because I have seen hundreds of others who, after 3 years, 5 years, 7 years, have had a beer, have had a couple glasses of wine, thinking that they're okay. And come to find out, it's building up all along. And once they trigger it, it fires away. And for me, the understanding of that is, it's not a threat walking into a pharmacy to work. It's not a threat walking into a bar with my friends and family and having whatever, a soda. The issue is all of the deceit and lies and uh, not facing my emotions that builds up to needing to cover it up. That's one of the things I talk about in depth in the book, is part of where this process comes from. The importance of being needed, of being first, of being the smartest person in the room, of always trying to know the right answer for everything at all points and times, and the incredible stress that puts over the body, and the emotions that build up underneath, and not being able to share them. I could listen to other people share what they had going on, but I could never share my fears. I could never share my concerns. I was always, the only thing I would ever let anyone see is how perfect everything is, when in fact it wasn't. It was crumbling inside. And so these days, that's different. My insides match my outsides at all points in time. And I have this clear description of, in the book specifically, of how I recognize in myself when I'm starting to have a disparity between the insides and the outsides, the physical manifestations of that and what happens. And I'm able to address it right away. Over time, if I didn't have those tools, if I hadn't learned how to address my emotions, how to communicate with others how I'm feeling, how to communicate with others what my needs are, then again, I would have this buildup, and it would build up to this constant chatter in my head of, who have I told this story to? So I make sure I tell this other person the same story, so that if they talk to each other, their lies don't get crossed over, right? There's a lot. That's a lot. And so when all of that gets going, it's easier just to cover it up, to subdue it with opioids and alcohol. That makes all of that concern go away. On the other side, as long as I am the same person I am on the inside as I am on the outside, as long as I'm telling the truth all of the time, I don't have to concern myself with anything about what anyone else is thinking because I'm telling my truth. And anything else that comes back to me is theirs. It's not mine.
Thank you for those insights. You have had such an interesting process that you've lived through. And the things that you now know, I appreciate you imparting your wisdom to my audience, but I think there's so much more in this book. And I really do need to read it because I'm interested in your story. And I respect you as a pharmacist and someone who has gone through recovery and come out on the other side and become a role model. And I love so much that you give your wife credit for standing by your side, being the glue that holds the family together. I think women do that. And I'm not trying to belittle you or anything like, oh, your wife had to. It's just she did it. She loves you and she's still with you. And in the book, you've got to check out this book, my audience, because there are pictures and you can tell that Steve and his wife Susie really love each other. It's beautiful.
Thank you. It
You're
is, yeah. The
welcome.
even right in the dedication, it's the book is dedicated to her, and she is definitely my lighthouse.
That's so sweet. I love that. All right, Steve, we're going to start wrapping this up. I think I've only got 3 questions left, and they're pretty quick. Once somebody reads the last page, what do you want them to do with the information in this book?
Well, let's see. First, I would like them to log on to Amazon and give me a review for it because I believe that that really helps increase the ratings so we can get it up there so other people will be able to read it. Next, I want people to feel how it affects them. Is there anything in that book, in this book, that resonates with them? And to meditate on that. How can that personally affect their own life? And then lastly, I'd like them to think about their connections, their colleagues, their friends, their family. Is there anyone out there who may benefit from reading it that they're aware of? And then pass it on.
I love those calls to action. Yes, when I'm done with it, I will write you a review on Amazon as well. I do that for all the pharmacist books that I read.
Thank you. I appreciate that.
You're very welcome. Now, we talked about Amazon just now and, reviewing it, but is there anybody else who carries this book or is it an Amazon only book?
So as a first-time publisher, I found it easiest just to go down that path. They were so incredibly helpful with the tools that they provided that it is currently an Amazon only book. I found we'll see how that plays out in the future, but for the time being, it's been working very well for me. What I like about their process is they do allow me to also order as many author copies as I want, and I have some of them in our local, one of our local community pharmacies. He has brought in a few books, and I'm going to go down to our local bookstore, and they're going to take a few down there for me. Just for a little exposure. I'm going to take a stack with me up to next week. I'm going up to University of the Pacific to talk with the students, my alma mater, and I'm going to take a stack of books with me there.
All right. I was looking for grad schools back in the year 2000, and you're never going to believe this. The University of the Pacific is in Pomona, right?
It's in Stockton.
Stockton. Okay. I went to a couple of different Bay Area colleges of pharmacy looking for either a
Hmm.
PharmD program or a master's program in pharmacy administration. And I was in that area. I think I've been to the University of the Pacific just to
Okay.
visit. So it's a
Yeah,
beautiful area.
it is. It's a lovely campus. I was fortunate to have the opportunity to be there.
Awesome. Well, I love that you're connected with your College of Pharmacy and that you're bringing your books to them. That's really cool. So, yes, they can get it on Amazon, but they can also get it right from Steve there at the
That's right.
university.
They can get a signed copy from me directly. Right.
Yeah, that's very cool. It's always cool to meet the author and have that physical print and have that name, just with the ink sunk into the page. I
Yeah.
personally am a tactile person and I love that. I dig that. All right. And then also, I got to bring up the fact that there is not an audiobook available yet, Steve. Do you have plans to create the audiobook?
Kim, I appreciate that. You're the second person that has asked about that. I hadn't yet looked into that, but after this podcast, I will. That's a very good point. And I will be reaching out to you to see what information you have about that. If you know a specific individual who does a great job at reading these types of books. Anyway, yeah, an Audible book will be forthcoming. Thank you for that.
All right. Yeah. Oh, I'll be cheering you on from Ohio because I not only do I have the I guess the printed book here on my Kindle app on my iPad, but I would love to listen to you read it or listen to a narrator read it. I think that would be really cool, like an emotional experience because I
Yeah.
believe in the book, I think in the introduction you said it's kind of like your emotional journey. It's not an autobiography, it's your emotional
It,
account of what happened to you, right?
that's correct. My emotional documentary of my life from graduating high school through today and the events that formed the person that I am today.
Yeah, I think an audiobook would really make that emotion come to life. So,
That's
anyways,
great. Thank
rooting
you.
for you.
I
You're
appreciate
welcome.
that. Fantastic.
You're welcome. And at this time, I'd like to invite you to read a sample of the book if you have one.
I do have a sample, and this particular sample, when I was talking initially about what to take away from the book, there were three particular things. The first thing was an understanding of the chaos that one individual can cause. And so I have quite emotional two paragraphs here that I'd like to read that goes deep into that and how it was for me and my family, probably about 5 or 4 months before I got sober. Maybe I would come home an hour late from work. Dinner would be cold, and the kids already ate. Susie would be angry and frustrated with me for not calling, and I would get upset back with her with a self-righteous lie. This would escalate to yelling, with confused anger from Susie, not understanding why I was becoming so increasingly erratic. And I would argue back, digging myself deeper and deeper into my lie, trying to make her understand. All the while, our 2 and 4-year-old children were in the next room, watching a show or playing with each other, feeling all of the emotions that were swirling around the home. Unknowingly, I would walk into the house reeking of anxiety and fear, absolutely petrified of how I was going to make it through the evening as a husband and a father. Susie would be waiting for me with anger and frustration from my lack of communication and rapidly decreasing level of parental responsiveness. After 30 minutes with each other, we couldn't help but soak up each other's emotions, creating an ever expanding dysfunctional mess. Hard to do that without tearing up.
You did a great job, and thank you for sharing that. A comment, if you don't mind, I would like to comment on that.
Please.
You mentioned that the sample that you just read was about the chaos that was going on right before you admitted what was going on and sought help. 5 to 6 months, I think you said prior to?
Somewhere around that. Yeah.
Okay. The words that I heard you say, the words frustration, anger, erratic, argue, lies, dysfunctional, petrified. There's a lot of emotion in there. Thank you for being so transparent about what was happening and how you were feeling and how your wife was feeling too, because somebody who is also going through this process or needs to confront somebody who needs to go through this process needs to know that it's messy and it's okay for it to be messy because it can still turn out great.
Yes. Very well stated. It is very messy. And the way that it turns out great is by everyone finally coming together with truth, authenticity, and honesty, and being able to, as I put it before, the idea of lying naked on the cold cement. So nothing is hidden.
That's quite the visual, Steve. Thanks.
Right,
We
huh?
gotta lift the mood here because that
Yeah,
it's a heavy
exactly.
topic. Thank you again for reading that sample. I think that
Yeah,
there's such an emotional connection when you hear somebody talk about something, and that was evident in what you read. So thanks again.
sure.
Steve, as we start to wrap this interview up, is there anything else you'd like to share?
Well, along with my wife, I really thank my children for putting up with the process. It created, over the after I stopped spinning and I became stable in the household, right? The kids still had their emotions. Everything was different, but not for them. And it took a while for them to calm down, and they had spinning emotions that carried them forward. On the other side of it, it was a benefit to them when they reached third and fifth grade and they went through their drug and alcohol classes, and they were able to come home and interview their dad on all of the different topics and take that back to school. And as of now, they're 30 and 32 years old, and we still have conversations about it regularly, which is really cool. We go out to dinner and they have their drinks or whatever, and I get my coda, my soda, and we have good, excellent conversations. It has healed the family so that we can be together and have good talk therapy between all of us, my wife and the kids and their partners, all the time, which is really cool. I'm impressed again with how recovery has opened the doors for my life. And I guess the last thing that I would really want to present is for all of the listeners to remember that your state's pharmacist or professional healthcare recovery program is confidential and anonymous. And you can call them and without telling them who you are, and tell them what's going on and say, hey, what do you think? I'm having trouble. What do you feel the severity of what I'm going through is? Because they will come right out and let you know how they think it's going, and then they can help direct you into a confidential treatment program, as opposed to hiding it and waiting. Because at some point in time, as we know, this is a progressive disease. At some point in time, someone is going to find out. As much as we think no one is going to, that we have it under control, someone will find out at some point in time. And then everything becomes legal and required and not confidential.
I appreciate you saying that. Student athletes nowadays, like I had a kid that just graduated high school, they adopt a similar approach. Either come out and tell us, or when we find out, it's going to be a lot worse.
Right,
So,
exactly.
wise words. Thank you for bringing that to my audience's attention. I appreciate you.
Thank you, Kim.
All right, Steve, thanks for your closing remarks. And thank you so much for sharing about your book and your story here on the Pharmacist Voice podcast. Take care.
Thank you.
Thanks again to Dr. Steve Leuck for being my guest today on episode 282 of the Pharmacist Voice podcast. When Steve and I recorded this interview back in March of 2024, full disclosure, I had not read the entire book yet. I read the Kindle version on my trip to Europe last month in May, and I finished it somewhere in Germany. It was great. 80% of the books that I read or consume, I guess you could say, every year are audiobooks. Only 20% maybe are print. Steve's printed book, that Kindle book, was worth my time, and I am so glad that I took the time to read it in print and look at the pictures. There are pictures, and they really add something to the book. Now, one of the things that Steve said he wants his readers to do when they finish the book is leave a review on Amazon.com. So, message received. I will read my review to you now. My review has been posted. The title of my review is Quick Read, Great Book for Pharmacy Students and Pharmacists. All right, now here's the review. I enjoyed this book. It was a quick read, and I would recommend it to all pharmacists, pharmacy students, pharmacy technicians, and pharmacy owners. And then I put 5 little stars. And then I wrote, transformation stories are powerful, and Steve did not hold back. From how he started using drugs and alcohol to his recovery, this 170-page memoir is comprehensive. My favorite parts were, number 1, the well-communicated timeline. Number 2, Steve's honesty and transparency about the details of his story. 3, his heartwarming, strong bond with his wife. One of the highlights for me was that Steve described his wedding day so well, I felt like I was there. And number 4, the happy ending. Congratulations on your sobriety, Steve. I enjoyed hearing your story. Thank you for all you have done for the pharmacy profession, your colleagues, and your patients. That ends my Amazon.com review of A Pharmacist's Story, an authentic tale of true love, family, addiction, and the practice of pharmacy by Dr. Steve Leuck. I hope you enjoyed hearing about the book from Steve and feel inspired to buy a copy and read it today. If nothing else, Learn from Steve's story and be a resource for others. And if you're thinking of writing a book, I hope that Steve has inspired you to get started writing today. Thank you for listening to episode 282 of the Pharmacist Voice podcast. Please visit thepharmacistvoice.com to read the show notes. In the show notes today, you'll find a link to Steve on LinkedIn, his book, and his blog. Plus, you'll find links to the 2023 Pharmacist Authors Series, my social media links, and more. If you know a pharmacist who's interested in writing a book, please share this episode with them. And if you like this podcast, please subscribe to or follow the Pharmacist Voice podcast on your favorite podcast player and YouTube to get each new episode right when it comes out, especially the next 2 episodes in this series. Dr. Helen Sairany will be on the show in July, and my conversation with Dr. Janan Sarwar and Dr. Thierry Chim comes out in August. Thanks for listening today. I'll talk to you next Friday.